Our next speaker, Simon Poole, I introduced yesterday as part of the inspiration for this conference. We met several years ago with Antonia at a Mediterranean diet conference, and you are a passionate activist and an olive oil importer, as well as being a family physician. So.
Yes, though that's a not-in-profit organization, the importing business, I need to say. First of all, I'm a family physician. I'm a full-time family physician, and I guess most of my time I spend communicating with patients. And I find communicating really, really important, and I've learned how much I can communicate about really important things to patients over the last several years. And how actually, by communicating to people, you can explain to them why they don't need an antibiotic prescription. By communicating to people, you can persuade them about lifestyle as opposed to necessarily automatically going out with a prescription for statin. So I'm a great believer in communicating. But before that, I'd just like to thank whoever brought up the subject of James Bond earlier. Who brought up the subject of James? I'd really like to thank you because, to be honest, I'm really pleased to be talking about an English hero, because I've been in Boston for a few days, and I've been walking around the Freedom Trail feeling slightly nervous that as an Englishman here, I'm maybe not that welcome, but I've been made really, really welcome. But I was pleased to hear about James Bond, a quintessential English hero, who of course smoked 60 cigarettes a day, who was misogynistic, who was a serial womanizer, and who drank double martinis by the barrel. Who would have thought he's a vegan now? And actually, I think we should hold that, because that's actually quite a tribute to the distance we've come in terms of some lifestyle features. And my interest in nutrition goes back a number of years to when I was clever and young and cynical. Is there anybody who's clever and young and cynical? Oh, no. Oh, he's gone. Sorry. No, forgive me. I was clever and young and cynical, and then somebody said to me, an old professor in Cambridge, England, said to me, "You know, we should be really, really hammering the smoking cessation advice." And I said, "Oh, come on." I said, "That doesn't work. People know smoking's bad for them. You know, we can't persuade people to stop smoking. They know it's bad for them. Why should we even bother?" And then I remember there was a seminal study in the BMJ, in the British Medical Journal, which said that actually if physicians take the time to counsel people about smoking, it can really make a profound difference. And so my cynicism was brought up short when I realized actually we could be change agents. And so as part of my lifestyle advice, I started becoming interested in nutrition, and particularly in the Mediterranean diet, because I declare an interest that I love food, you know, and I wanted my patients to love really good and healthy, nutritious food as well. So I started counseling and spending time counseling patients about food and lifestyle, in particular the Mediterranean diet. And the feedback was really positive. And then I kind of got invited to talk to women's institutes in village halls in England. You probably don't have women's institutes in the US, but these are. Well, it's like cricket. I couldn't explain it to you. But these are groups of very, very highly influential women who meet in village halls and invite speakers and give them a rough time. And so I got invited to talk to women's institutes, and then got invited to talk to medical students and to other physicians and to dietitians. And that really struck me as quite extraordinary. And the level of knowledge and information amongst fellow physicians, practicing physicians, is extraordinarily poor. And there was a recent study last year done in New York with cardiologists where I think 13% of them felt confident to give nutritional advice. And only a tiny proportion thought that they actually, only half of them knew that there was no evidence that low-fat diets actually reduce cardiovascular disease. There were lots of fascinating bits of information from that study which showed just how poorly trained and how ignorant physicians are in counseling patients about nutrition. I was invited to a European Society of Cardiology Congress a couple of months ago in London, and I threw down the gauntlet and I said, look, if somebody comes out of a cardiologist's office with a high risk of cardiovascular disease and they're not put on a statin, that's litigation. That's negligence. And yet we know that lifestyle, nutrition in particular, is so much more powerful than statins, and yet it's considered to be entirely routine that people come out of cardiologist's office with no nutritional advice whatsoever, at least in the UK. So I have talked also to the food industry to talk to them potentially about how they can make the kind of changes that Dan's been articulating. And finally, I also have the privilege of having a role in the British Medical Association, the Royal College of General Practitioners. And so I get the opportunity to meet with policymakers and have learned the importance of really trying to be completely upfront with policymakers about how important it is. And I said this morning, and I passionately believe that it is absolutely morally indefensible, the kind of leadership that we're seeing on occasions from our politicians about the absence of courage. And in one such meeting where I was invited to meet the new Secretary of State for Health in the UK, he started off by saying, there were a group of us in the room, and he started saying, well, my average tenure is not 10 years, it's 2.5 years. My average tenure as the Secretary of State for Health is 2.5 years. I want you to help me to see how I can deliver my 4 priorities, which are dementia. I mean, I don't know what that meant, but his priority was dementia. And a decrease in mortality. And then there were another couple of things. And so we got herded into a room by some civil servants and said, right, well, just explain to Jeremy, please, how he can cut mortality in a couple of half years. And so some of us were public health physicians and myself. Actually, I'm afraid it's bad news. We're looking at about 5-10 years. We're looking at making really, really courageous public health decisions, like in the UK, we've got a ban on smoking in public places. And we've got to do this with nutrition, because nutrition is key. So you've got to take some courageous legislative steps. So it's down to you, really. You just need to increase taxes on unhealthy foods, and as long as we can decide what they are. And the civil servants said back, well, no, that's social engineering. That's the kind of thing they do in Scandinavia. I mean, and I'm paraphrasing a bit while making it up, okay. But so they said that's the kind of thing they do in Scandinavia. We don't do that here. And the observation from one of the public health physicians was, look, you take a child in a buggy, in a child's buggy, and they're being taken in the line. I've got to remember my language here. So in the queue, in the line, and they're waiting to pay for the groceries. What do they see in front of them? Kids level. They see colorful, beautiful, really unhealthy candies, chocolates and if that isn't commercial social engineering, what is? And unless we combat this with political social engineering in a positive way, we haven't got a hope. So I guess that perhaps gives you a kind of breadth of where I come by. I've been described as I'm not sure whether it's a compliment or not, but as a nutritional activist. I'll take it as a compliment. But so I basically try and promulgate the idea of positive good nutrition based on good science, particularly around the Mediterranean diet, for which I think we've got a lot of robust science, provided by at least 2 people in this room, and try to influence policymakers and try and communicate with patients, the public, and also government.